One of the smartest marketing decisions you can make as a post-op massage therapist is to decide which of the two types of plastic surgery clients that you want to focus on getting into your practice and onto your table and onto your books. So one type of plastic surgery client out there is focused on, they want specific results from their plastic surgery, visual results from their plastic surgery, and they're on a tight budget. So they're looking for a surgeon by price. They may be willing to go out of the country to get that price, and they are extremely visually focused on befores and afters and getting results of their plastic surgery. And the other type of client wants results. They may use more words like they look refreshed, and they are focused on safety. They're focused on staying safe and investing money wisely to get a safe experience with plastic surgery. They're looking for a more high-touch experience. So this is the client that will want to meet with their surgeon at a consultation, whether it's over the internet, over telehealth, or whether it's an in-person consultation. They will want a high-touch experience with the plastic surgeon. These are where these longer conversations with the plastic surgeons, what type of surgery do I need? They are expecting to get some kind of pre-op care from that surgeon. So the blood test, they're expecting to get counseling so they more fully understand what their experience is going to be on the day of surgery and the recovery. They're expecting from their surgeon printed out handouts on exactly what they should be doing during their recovery. They are expecting that that plastic surgeon have the expertise and experience, and that the staff is going to be more available to them both before the plastic surgery and especially after the plastic surgery. This is the client that will have the personal cell phone of the surgeon in case they have any questions. Will have the cell phone of the nurse and will know that if they pick up the phone and ask a question, that they won't just get we'll take a message and then the surgeon never gets back to them, that they expect to have an answer. And they will pay more for this quality of experience because they are paying for their peace of mind and for the safety. So make no mistake, this client wants results as well, but they don't want to risk their life to get those results. So once you decide which of these clients that you want on your table, that is where your focus is going to be for your social media. That is how you're going to talk to the surgeon based on which surgeons you want their clients referred to. So if someone is going just on budget, their surgeon won't have referred them to you specifically. Their surgeon may say that they need lymphatic massage, but they won't have all the details, and they definitely won't have a big list because often this client will have flown in from out of state. And it's tough to build up those long-term relationships with that surgeon's practice because they'll tend to have a high churn of employees. And the people who come to you, if the clients do find you on social media, which is most likely where they're going to find you, they may have said that their person that they were assigned to in the practice to answer their question may have actually changed from the time that they first booked the appointment to the time that they're fully recovered from the surgery. There won't be just one point person for them throughout their surgery journey. But they may find you because you're more active on social media. And so you need to be out there and be maybe answering the questions that if they got ghosted by their surgeon, they're going to have a lot more basic questions that they need answered. So they may actually be on social media much more, looking for answers for their surgery, having a lot of questions about their fibrosis, a lot of questions about fajas, a lot of questions about swelling. And then so if you are active on social media and you're telling them your experience, your expertise, and the price is right for them, that they can afford this care from you, they may go ahead and find you on YouTube, find you on Instagram, find you on TikTok, and book that appointment with you. So also, you'll have to educate them as to how many visits and how much investment they'll really have to make to hire you to actually make a long-term difference from them. Maybe they will come in and think that they only have to have 1 or 2 appointments with you, and then all their problems will be solved. So there's a lot of education that you have to take time and educate this client on how much they will have to spend on their post-op recovery. If you are going to get a referral source from a plastic surgeon who their whole practice is focused on safety, and that's the message that they're giving to their clients, this plastic surgeon's message will be about the expertise, about their experience, about their board certification, about the safety of their facility, about the knowledge that they are going to give to their clients, and they will put clients up and have them talking. So you'll see pictures like before and afters, but you'll also see podcasts. You'll see a lot of individual clients talking about their experience, because their client, their goal client, their dream client is someone that wants the results, but they also want the high quality experience. And they're not willing to go cheap just to get results and then feel like just another number, just another cog in the assembly line, and kind of taking a risk if there's any complication that maybe they won't have someone there. So this client that is focused on safety, that plastic surgeon may be more likely to refer people to you. That plastic surgeon may be more likely to listen to your clients about their experiences in your massage as they're going to that post-op visit. And that nurses will listen to that experience, and they will listen to you, and they will look deeper into your background and your resume and the type of training you have before they will refer their clients to you for post-op. So this is, if you want to get a collaboration with a surgeon who's focused on safety, they're going to be looking into your background as the massage therapist. They are not going to be excited about how you took just a weekend class and now you have all these certifications that are in fact just pieces of paper, and you don't actually have the experience and expertise to confidently help their clients. So it's a totally different ball game. It's so much more rewarding, though, if you want to focus on clients that are interested in safety, because these, for me, the clients that their plastic surgeon has physically referred them to me by name are the clients that will more readily rebook. They were more interested in what is everything I can do to maximize my results. And they're interested in rebooking. They're interested in taking everyone's advice and having their best recovery.